Hello everyone, welcome back with Dr. Fakher Fatima. Day 2 of Derma important topic psoriasis. Psoriasis basically derived from Greek word psora means itch, and it is highly stigmatized and common inflammatory skin disease, the antidote to the dermatological ego. Okay, here you can see the biomodel age distribution. Here you can see the biomodal age distribution. Psoriasis aggravated gradually with the passage of time, passage of age. Although in some respect this is true, major progress has been made in several important areas of management. Psoriasis is basically a common inflammatory disease. It is the common inflammation disease of the skin. It can be relapsing and remitting. It can occur at any age, although it is uncommon in children. You can see the age 0 to 17 and the graph 18 to 39 and 48 to 49 age and 50 to 69 of age distribution. Basically, psoriasis typical with sharp demarcated dull red black. Here you can see the sharp demarcated red black with silvery scale. Okay, it is not contagious, but there is often a family history. It can be well controlled, and treatment aims are to minimize skin manifestation. Basically, in psoriasis, we can deal with the presenting complaint of the patient and improve quality of life. However, even patients with minimal involvement say that psoriasis is a major impact on their life because it is the severe inflammation of the skin, and the itching is most common presenting complaint of the patient. Here you can see the normal healthy skin and the psoriasis skin. On the surface of the epidermis, you can see well demarcated red, black, silver scales. It is basically common complex immune mediated inflammatory disease and causal factors. Causal factors include the genetics. It may be genetic, stress, it is stress induced, skin trauma, behavioral factor, obesity, alcohol, smoking, some medication, and some infections. Before meet the patient with psoriasis, we must know the affected area, including the scalp, trunk, gluteal fold, and the extensor surface of the elbow and knee. Here you can see in the picture there are the 5 different locations of the psoriasis. First of all, facial psoriasis. Facial psoriasis affect about 23 with people with psoriasis. It can affect on any area of the face, including the eyebrow, the skin between the nose and the upper lips, as well as the upper forehead. In hand, feet, and nails, we can call the triple P, PPP, refer to psoriasis that affect the palm of the hand and the sole of the feet between 12 of the age and 16% of the people living with psoriasis having palmoplantar psoriasis. Nail can also occur in 50% of the people with psoriasis. Scalp psoriasis is very common, affect over 60% of the people living with psoriasis. Scalp psoriasis can affect the hairline. The hairline of the patient mainly damage the forehead and the back of the neck and the skin and around the ear. The best place for psoriasis is skin folds under the arms, under the breast. These areas are often irritating by the rubbing and the sweating. On proceeding our topic, genital psoriasis is very common. Up to 2/3 of the people with psoriasis experience genital psoriasis in some point in their lives. Genital psoriasis can affect the skin in the genital area as well as the inner and the upper thigh. Here we can see the psoriasis subtype. The clinical feature of psoriasis is different on the psoriasis variant, although no variant may predominant. The three clinical features: erythema, means the redness of the skin, thickening, and scale. The silvery scale always present on the psoriasis skin. First of all, we discuss plaque psoriasis. The plaque psoriasis is most common variant affecting up to 80% of people with psoriasis. Plaque can appear anywhere on the body, are sharply demarcated, raised patches, or inflamed, itch, and painful skin with scales. The second one is cutis psoriasis. As you can see in the picture, cutis psoriasis. It is not very common. It is just roughly present 8% of the people with psoriasis. Small red spots caused by the inflammation. It may appear on the arms, legs, and the torso. It can clear within 3 to 4 months without getting any treatment because it is the staph infection triggered the cutis psoriasis. It is the best and the good prognosis. If cutis cirrhosis proceed, it develop chronic plaque psoriasis. The major difference between the P. rosacea and the Psoriasis lichenites is the appearance and have a similar presentation but not proceed with the throat infection. In cutis psoriasis, there is present a throat infection, but in the P. rosacea and the Psoriasis lichenites, there is no proceed by a throat infection. Erythroderma psoriasis, it is most important, most dangerous. About 2% of the people living with the psoriasis and intense redness and the shedding of the skin layer in the larger sheet. It may contain the severe itching, pain, changing in the heart rate, temperature, dehydration, and the nail changes because the skin is continuously shedding. The last one is pustular psoriasis. It affects about 3% of the people with the psoriasis. Painful white pus-filled bumps may be surrounded by the inflammation on the red surface. As you can see the pictures, these pictures clearly reflect our context. Proceeding to our topic, scalp psoriasis is very common. About 56% of the people living with psoriasis have scalp psoriasis. Inverse psoriasis, it includes inflamed, deep red skin that is commonly smooth and not scale. In inverse psoriasis, there is typically not usually seen the cerebral scale. Inverse psoriasis affects skin folds in the body, such as the underarms, underbreast, and genital area. The history and the clinical examination is very important. Do not mix inverse psoriasis with the fungal infection. In this slide, where you can see the nail psoriasis mainly affects silver digits, and the more common on the fingernails, on the toenails, pitching, deformation, thickening of the nail, oncolysis, suppression of the nail from the nail bed, and discoloration present. The psoriatic arthritis affect 30% of the people with psoriasis. Chronic inflammation disease of the joint. When psoriasis left untreated, it mainly causes psoriatic arthritis. It connects to these inflammation connect to the tendon and the ligament to the bone. The most important point is psoriasis is usually diagnosed by the clinical appearance, but a biopsy can be performed to determine the type of psoriasis and rule out other skin disorders. Here is Eleni, our patient. The conversation with the doctor is present. The presenting complaint is Eleni is the 23-year-old female. We present with a red scaly rash, has been present for 2 months. Rash is not itchy, very upset with dandruff appearing on her shoulders. In the pictures you can see she thought she might be suffering with dandruff, but the most important clinical features present for the psoriatic scalp is it run with the hairline. It run with the hairline. It destroy the hairline. Okay, the initial history point, the 3. Do you smoke? Yes, she smoker. Does anyone else in the family? She says her mother is suffering from the psoriasis. Are your finger or the toenail infected? No. Do you have joint pain? No. Are you on regular medication? No. Have you ever tried any over-the-counter cream or ointments? Yes, I have tried normal anti-dandruff shampoo. After history taking, the clinical examination is more important. You can see the red, black, the red, thick adhesive background on her elbow and knee, and reddish background around it hairlines. Nails are normal, joints are normal, eye normal. Her mother has psoriasis, she is a smoker. The two differentiated for anally diagnosis is seborrheic dermatitis of a scalp or scalp psoriasis. Here is the correct answer, and the reason is present. It is most likely diagnosis is scalp psoriasis, which means you can see the red erythematous skin with silver scales are present, and the itching is common symptom of scalp psoriasis. Do you think why not dermatitis? A very good question. In the dermatitis or in the dandruff present with more yellow and the waxy scale, while in the psoriasis the skin is erythematic, inflamed, thickened, and silvery scale are present. The two main phenomena, the two main points are important in the diagnosis of psoriasis. First one is Asperger's signs, and second one is Kopner phenomena. In the Asperger's signs, when you lift the scale, when you lift the scale with the plaque, a pinpoint plating may occur. And in the Kopner phenomena, this may is due to the sunburn, pressure, cutting, scratching, cutaneous skin injury. The question for Annalie about the condition being contagious, yes. No, it's not contagious. This condition is hereditary because her mother is also suffering from psoriasis. In this case of the management and the treatment, in the topical medication, the salicylic acid is very good result. The minor steroid, vitamin D derivatives, topical ointment and the cream are very important. Diprosalic scalp application once or twice per week, Dovapet, 5% LPC in betanoate, 5% a good emollient with the betanoate. Here you can see some important pictures. Okay, what are Alani modified risk factors? The smoking status, stress, alcohol, assumptions, expect family history of psoriasis. Okay, some security texts are important. Arthritis, because for the psoriatic arthritis, depression, cardiometabolic disease, because psoriasis is aggravated with the beta blockers, inflammatory bowel disease. Okay, three important factor is very important: prevention, maintenance, and the avoidance. First of all, avoidance of the trigger is to scratching, extensive combing, pulling of skin, and smoking. Topical cancer inhibitor, be aware of irritation. Space uses of topical steroids 1 to 2 times in a day. The most important vitamin D derivative in topical care for the pregnant patient is not recommended. The most important skill according to body mass index, if it is mild psoriasis, it is less than 5%. It is moderate 5 to 10%, and severe greater than 10% of PSA. The medication for the mild or the plaque psoriasis, topical steroid, tricholomers monohydrate, coltar, calcitrol, the medicine propionate. And when it may be severe, methotrexate is very good result. Acitretin, cyclosporine, mycophenolate, and biological therapy. The summary of psoriasis is trigger and the aggravating factor, lifestyle advice, skin directed application, emollients, topical treatments, and assessment, immediate refer, routine urgent refers, and the management. Okay, thank you.